Hello and welcome to Achieving Measurable Collective Impact with Results-Based Accountability. My name is Deetri Epps. I'm a partner and senior consultant with the Results Leadership Group, and we appreciate you joining us on today for our final webinar in the series. We're very excited to have been connecting with you over the past several weeks and look forward to sharing information with you on today's webinar. We're going to start off by asking you to share a little bit of information about yourself. You'll notice that a poll will come up in a moment, asking you to share about your experience with collective impact and results-based accountability. I'd like to also introduce you allow Marquez to introduce himself and tell a little bit about your role, and we'll go ahead and get started with the first poll.
Hello everyone, Marquez Frazier here. I'm also a consultant with the Results Leadership Group. I'm happy to be on the call today, joining you all for the final webinar in the webinar series around collective impact and RBA. Looking forward to a wonderful presentation. Thank you, Deetri.
All right, so we'll go ahead and launch the first poll. So you can tell us a little bit about yourself regarding are you new to results-based accountability? Are you new to collective impact? Would you consider yourself to have practiced results-based accountability? Or are you a part of a collective impact initiative that has not yet implemented results-based accountability? Or are you of this unique set of folks who have applied results-based accountability to a collective impact initiative? Please take a moment and tell us about your perspective or your experience in each of these areas. And while you're taking the poll, I'll share a little bit with you about the webinar series. At the close of the webinar today, you will receive a survey, and we're asking that you complete that survey. It will be from Marquez Frazier. We're asking that you complete the survey, and after the survey, you will have access to both the webinar slides from today and to the recording from today's session. So if you could please take time to, at the end of the webinar, to make sure that you click on to the link and take the survey. Excuse me. So we're going to go ahead now and share the information with you. We'll go ahead and close the poll for now, and based upon your input, 9% of you are new to results-based accountability, 22% are new to collective impact. The same percentage, 22%, have practiced results-based accountability in another forum or in a collective impact, have practiced RBA. 35% are part of a collective impact initiative, and 13% have applied RBA to a collective impact initiative. So you can see that over half of you have practiced either RBA or collective impact. So your input is really important to us on today. As a part of today's objectives, I will work towards supporting your deepened understanding of results-based accountability and its application to the conditions of collective impact. You'll have a chance to understand how RBA's disciplined turn the curve process can be applied to the conditions of collective impact. And on today, we'll focus on two conditions. We'll give a general overview, but we'll focus on the two conditions of continuous communication and having a backbone support organization. You'll also understand how you can join in the development of a community of practice for shared learning around these two areas of interest, achieving measurable collective impact with results-based accountability. So as we have done in the past, I'll share with you that I am presenting this webinar series from my perspective and my experiences. So you'll hear me talk about the work that I've done in each of these areas that you see listed here. Various experiences will contribute to what I share with you today, ranging from being a community leader to being a program evaluator. But most important in this webinar series is the communication that goes back and forth through the interactive polls you see on the right-hand side. As you participated in this initial poll, we'll have some other polls throughout the webinar, and we ask you to include your input. We have registrants from across the globe, including all of the countries that you see listed on the slide. We're really excited about that, and we're looking forward to remaining connected with you, not only in this webinar series, but after the webinar series as well. So welcome for those of you who this might be your first session, and you will receive a good amount of information today. If it's a session that you've been in each of our sessions in the past, you're still going to get a lot of information from today's session about the two conditions that we'll focus on today. We know, for those of you who have practiced results-based accountability, that there are two key principles to RBA, commonly known or affectionately known. We call results-based accountability RBA. So you'll hear me use those two terms interchangeably. But the first principle of results-based accountability is that we start with the ends and we work backwards to the means. In other words, what is the end result that you want for your community or for your clients? Start with that in the as a focal point of your work, and then we work backwards to the way that we will get to that result. Oftentimes this is different from the way communities or programs work. They oftentimes start with strategies. What are we going to do? RBA actually starts with the ends and works backwards to the means. The second principle is data-driven, transparent decision-making. We always use data to drive the decision-making, and we actually have two types of data, both quantitative and qualitative data, as a part of results-based accountability. You'll remember, for those of you who are joining again, that we have the turn the curve thinking that helps groups move from talk to action very quickly. And the first part after finding the result that you want with your community or for your program, the first thing you want to do is look at data that shows how are you doing. These are the core steps of RBA that you see listed here in this slide. And once we have a trend line that shows how we're doing, we'll ask, why does the data look the way that it does? What are the contributing factors to the data in the historical view? And then who are some partners that can help? What are some options that will work to address the factors that you've identified in your story behind the baseline? And then after considering each of these core pieces to RBA, then the last step is, what do we propose to do? The development of a comprehensive community action plan that includes a budget. The 5 conditions of collective impact are listed here, and we'll briefly do a quick glance at the first 3 that are listed: a common agenda, a shared measurement system, and mutually reinforcing activities. These were the core of previous webinars, and on today we'll go more deeply, as I shared, into the last 2 conditions of collective impact as they relate to RBA: continuous communication and a backbone support organization. So, a common agenda, let's start with that. The first part of a common agenda that relates to RBA is affirming that your group has an explicit result statement to express the desired condition of well-being for your community partnerships work together. This result statement is sometimes found in a mission statement or in a vision, but with RBA, we want to make sure that it's simple and concise and clear enough that any community member or resident can relate to it. And then the second application of a common agenda is there is a co-development of a comprehensive action plan with community-wide strategies, and the partners whose roles are very clear have contributed to the development of the plan, and they also engage in the implementation of the plan. So this is not a plan that a group of people come together and write, but they don't have a role in implementing. So you move from talk to action very rapidly once you develop your common agenda. Again, a shared measurement system is an important part of RBA's work, and we apply that in 2 ways. We distinguish, first of all, between population measures, which we call indicators, and performance measures. making sure that there's a clear separation between the two, and that also there is a clear way of improving population level measures where all partners are working together. And then there is a clear way for organizations to work together within their service systems to improve the well-being of the clients that they serve, whether that be at an organization level or a program level. So the shared measurement system is very clearly a part of RBA, but the shared measures also have clarity around if it is a population measure or if is it a client measure that shows how the people that you serve are actually better off. We've spoken about mutually reinforcing activities, which has 2 RBA applications. The first one is that strategies and partners are clearly identified to address multiple factors of the story behind the data. Once you look at that story, you're going to find that there are several factors that improve the data historically, or there's several factors that have been in place that are restricting the data. And you want to be clear about, as a partner, which of these factors am I addressing with my strategies? What is my role? And then what is the role of the other partners in addressing some of the factors that we've identified? The second part of mutually reinforcing activities is that leaders are working collaboratively to align their actions to maximize client impact at the performance accountability level. You'll know from the Collective Impact Forum that we have connected you to in the past that continuous communication is one of the conditions of collective impact. And as defined by the Collective Impact Forum, it means that building trust and relationships among all the participants of your community partnership. This is no easy task. Trust building takes time. And with results-based accountability, one of the second principle is data-driven, transparent decision-making. It takes time to get to transparency, and it takes time to communicate with your partners in ways that are trust building. And so when we think of continuous communication, and 2 possible applications within RBA. The first one is that partners understand and use a simple common language during local community partnership meetings. We've spoken about a common language and as a first step to building trust and building relationship. But later on, leaders need to have resilient relationships that include transparency, trust, action, and alignment across all of their work. So these 2 applications of RBA, we're going to talk a little bit more in depth about these on today. So let's look at the first application, where partners understand and use a simple common language during local community partnership meetings. I want you to take a moment and think back to the last meeting you went to that engaged several partners across several organizations. Imagine in that meeting, did you have a common language that you were using that used the same terms as other partners? Or do you have a different language that you used because that's the language of your organization? This challenge can also be magnified if you're working in communities that have more than one language. If you are in a bilingual or even trilingual or more community where you might have Spanish and English participants that speak both Spanish and English, or perhaps only participants that are monolingual either for English or Spanish. So this common language can be very, very important when thinking about building relationships and continuous communication. For today, we're going to focus on the English component of the conversation and having a common language that looks at the result being defined as a condition of well-being for children, adults, families, or communities. And as you know, a result should be a simple statement, such as the ones that you see listed here. In some communities, this is also can be called an outcome. So in either way, you want to make sure that your community partnership has this condition of well-being, and it's called the same thing by all of the partners that you're working with. And that you have measures that quantify the achievement of this result. It's recommended that, I recommend that you call this an indicator whenever you're talking about population accountability. And so that when you look at things like the rate of low birth weight babies as a measure of if babies are born healthy, you will know when you say indicator that you're talking about a geographic region such as Baltimore or Toronto, or even a state like California. But you want to use the term indicator consistently across your partnership, or another term that you decide upon. Within RBA, we use the term indicator at the population level. At the performance accountability level, we use the term performance measure. It sounds pretty straightforward, but it's not always as simple as it seems. A performance measure measures how well a program, agency, or a service system is working, and there are 3 questions that it answers. How much did we do? How well did we do it? And is anyone better off? These are the customer results or client results. And before you have a common word, result, at both the population and performance accountability level. So if you're talking about performance accountability for a program with your clients or your customers, simply put the word client or customer in front of it so that it distinguishes between the results at the population level. You may want to do the same thing with the word indicator. If within your partnership you often use the word indicator to talk about programs, put the word client in front of it so that you know that you're talking about a measure that refers to the clients. A client indicator would be a performance measure for is anyone better off that comes to your program. The reason we take time with results-based accountability to talk about this is because there's a language trap that exists in health and human services and even education, that oftentimes words are used that have various meanings depending upon the organization that you're coming from. And all of these words, there are just too many terms, and there are too few definitions of these terms. RBA is a disciplined step-by-step process to help support a common language amongst your partners. And there isn't a lot of discipline in the field when looking at these terms. So if you take a look at the circles on the outside, for example, like benchmark or target, you could even oftentimes have added confusion by putting modifiers in front of them. Like we have urgent performance targets or core strategic results. So we recommend that within your partnership, you move away from having many terms that are used by many partners to having common terms that are used by your in your membership meetings together. And if you think about it, words are labels for ideas. So the idea is more important than what you call it. So let's think about the idea of a condition of well-being for children, adults, families, and communities. You could call that idea, one group in your partnership might call it a result, another group might call it an outcome, another group might call it a goal, and that's okay as partners. This is not the language police. You basically want to make sure that when your partner is using that term, that it relates back to the same idea so that you're each understanding one another. It's helpful to select one of these as your group's, your community partnerships language to express a condition of well-being for children, adults, families, and communities. And the reason that this is important is because you want to, again, distinguish between population and performance accountability. Because if your partner is talking at the population level and you're speaking about the clients at the client population level, this could lead to some confusion in basic reporting out when you're speaking to one another, whether you're talking about a program measure or a county measure. So take some time and create a language that you can all use together when you're having your meetings. And then when you go back to your organizations, you may have a home language that you use that might be similar or different from that. So this is the first application. Understand and use a simple coloring. The second application is around leaders having resilient relationships that include transparency, trust, action, and alignment. And let's talk a little bit about that. I want to give you an example of a case study in Florida that really started out at an organizational level and then continues to grow to a statewide level. So think about building a movement in your community and if your organization or your partnership might grow in this same way and having continuous communication. So the case study is around South Florida in the United States. And it started off, I had some work in 2009 with an organization called Connect Familias. And they asked me to come in and use results-based accountability and training to help support them to move from having wraparound services to really having an engaged community with connectedness across their partners. And so they changed from having a wraparound services perspective to creating a result that was clear, that they keep families safe, healthy, engaged, and connected. So this was in 2009. Shortly after this time, the Children's Trust began to use results-based accountability for Miami-Dade, Florida, and they developed a results-based strategic plan for investments where they have approximately $100 million annually, and they developed several results and invited the community partners to share those results with them and help to improve indicators associated with those results. One of the initiatives that they used as a part of this work was the Read to Learn program. Some of you may be familiar with the Campaign for Grade Level Reading. They implemented community meetings in several neighborhoods using the results-based accountability framework and the indicators that were part of the Campaign for Grade Level Reading, which are around school readiness, the summer slide, improving and reducing the summer slide, and then also third grade reading scores. And each of the communities were able to see their own local data and look at what local strategies might be put in place to help improve that data. So you can see the same language, use of the language and from Connect Familias and results-based accountability then began to be used with the Children's Trust in several other neighborhoods, not just Little Havana, but several other neighborhoods around Miami-Dade. And then the next group that began to, one of the next groups that began to use results-based accountability was the Florida Oral Health Coalition. This is a group of partners that came together to create Florida's oral health roadmap. The result being all people in Florida have optimal oral health and well-being. They have 2 focus areas, and they also have indicators associated with these focus areas. So the movement began to grow. The communication around the use of results-based accountability for community impact began to be supported by an increasing number of partners, and partners began to understand the importance of sharing data with community members, community residents, and making sure that there were quantifiable ways of showing that the data was being improved. And currently, there is the Oral Health Alliance, sponsored by the Florida Institute for Health Innovation, which is also in the United States. And this group meets together to focus on a specific part of oral health, which is Medicaid, and that children are receiving preventive and other dental services at especially vulnerable children. And they are using a collaborative decision-making process. They've identified a result and the indicators for success, and they're using collaborative leadership practices, focusing on indicators to drive specific strategies for well-being for young children, especially with their oral health. So I just wanted to describe this to you as a way that you can begin small, communicate, and create effective partnerships at a small neighborhood level or even organizational level, and grow and build trust and resilience and relationships across time so that you're building a culture of results in your communities and in your community partnerships. Currently, the Health Foundation of South Florida, again in the United States in Florida, has created healthy community partnerships. And this builds upon these same concepts, and they have created a multi-year focused investment in 2 communities, Little Havana and the city of Miami Gardens. And the community partners themselves have selected 5 health impact areas and designed local community action plans. They have an infrastructure that has host councils, which is like a steering committee or an executive board. They have sub-councils around specific impact areas of health, and they are planning and sustaining and implementing the strategies that they have selected for the community. So it's really important to think about how can you in your community begin to bring partners together at whatever level you're working, whether it be a large level of a community partnership or if you're starting off as a small organization. But building trust and having a common language are an important part of this work. As you think about the movement that you're hoping to create in your communities, I wanted to talk a little bit about building of trust. And I'd like to share with you some information from Stephen M.R. Covey. This is from the book Adapted from the Speed of Trust. And I thought that it would be helpful for you to consider in your partnership meetings, how close are you to creating this movement that other partners are engaged in this work together with you, and that you're beginning to build the trust that is necessary to drive decision making and make it transparent. These are some examples that Stephen Covey shares about what you can look for when you're looking at trust. Think about your partnership meetings. Is there information shared openly? Are mistakes tolerated and encouraged as a way of learning? Is the culture of your partnership innovative and creative? Are people loyal to people that are absent? These are some things you can think about when you're looking at building trust. A lot of people avoid conflict in meetings and don't feel as comfortable with having conflict, but it's important to allow space for conflict, that people are talking straight and confronting real issues, and that there's real communication and collaboration even in the face of conflict. Results-based accountability speaks about sharing credit in ways that all of the partners contribute to improving the data. This aligns really well with people sharing credit abundantly. It's important when building trust to release the desire and the need to say, this improvement happened because of my organization, or also reduce the desire to say, this community is not doing well because of this department. And taking shared accountability goes both ways, both for the improvements in data and for the challenges when the data is not doing as well as you would like for it to. As you think of your community partnerships, are there meetings after the meetings that some are not included in? Or is transparency valued as a practice? Are people candid and authentic in the meetings with a lot of accountability around improving the data? Hopefully, you're attending community partnerships that have a palpable vitality and energy, and people can feel the positive momentum. These clauses that are taken from the Speed of Trust are very, very applicable to the type of environment that you want to include in your community partnerships. I think you'll find this to be amusing, but I hope it's not happening where people in your meetings are saying, you know what, we're doing great, and I'm sure glad the whole isn't at our end, when the community is not doing well with the data. Are you trusting one another to say, you know what, we need to do well as a whole, and all of us together need to make sure that we're safe and secure and that nobody is sinking, as you can see in this graphic. So let me ask you, we're going to take a moment for a poll, and I would like to ask you a question about trust. And when you think of your own partnerships, do you think that there is low trust amongst your partnerships, or do you think there's a high degree of trust? This is about your community partnerships when you're working together. Is there high trust or low trust within your community partnerships? We'll give you a little bit of time to weigh in according to your perspective in your community. Is there high trust or low trust? Take a few more seconds. Well, interestingly enough, half of you are saying there's exactly half are saying there's low trust, and half, 50%, are saying there's high trust. So that's the results of the poll. So we have, I don't know if you're a glass half empty or a glass half full kind of a person, but it's 50-50 split down the middle according to those of you who are on the poll. So either way, there's some work to do around trust building in the community partnerships. Of course, partnerships are made up of organizations. So I want to ask you a similar question, which is now around your organization. Would you say that your organization has a high level of trust or a low level of trust? How are things going internally within your organization? Trust starts from home. So when you're in your home organizations, how is that environment? I'll give you some time to weigh in on this one. Within your organization that you work within, is there high trust or low trust? Okay, we'll go ahead and close the poll now at this point. And the same information, 50% say low trust and 50% say high trust. So it's not surprising that the level of trust may be the same at the organizational level that it is at the partnership level. So there are strategies that you can implement in order to build trust. And as we move forward to the conditions of collective impact, I'm going to talk a little bit about how do you go about building trust. And we're going to look at that through the lens of the fifth condition, a backbone support organization. So what does that mean to have a backbone support organization? According to the Collective Impact Forum, this means that you have a team dedicated to orchestrating the work of the group or the work of your community partnership. And how can that help to support trust? Well, I have an example that will be shared through building a skilled implementation team support and how that can help to build trust. So one part of a skilled implementation team is having skilled coaches or facilitators that are supporting the work of the group as a whole. We've had some questions on previous webinars during the question and answer period about the facilitators that are helping to guide the work of the community partnerships. It's very important to have a skilled facilitation of these sessions, and that's one important application. The second important application is to have a project management group. You might in that group have one project manager. The examples that I've been sharing with you have a project manager and a project assistant of the Leadership in Action program that I shared with you in the past, as well as an on-site logistics lead as necessary, or an on-site captain. Now, how can this support the work of the turn the curve thinking? How can these teams support this work? When you think about it, this really is a group of partners that are moving from talk to action to improve the result. You've researched the story behind the data and you have brought together several partners that have a role to play in turning the curve. These partners are going to each be asked to, or they will say, our role is to address the various factors that you have detailed. And the partners come from different backgrounds, different environments, different organizations. All of these partners that have a role to play in turning the curve each have, when they come into the room, an agenda that brought them into the room. So it's necessary to let go of that agenda sometimes in order to think of what is best for the result as a whole. Results-based accountability says who can help to address the story or the factors in the story. And so when you come into the room as a partner, you're thinking about the result and not just about your agency alone. In addition, there are partners that have the lived experience that may not come from an organization at all. They may come as community residents, and they may not have the education, or they may not have, when we're talking about like higher education, they may have a different level of education, and some may be from a very academic background with a PhD. So you have a variety of partners in the room that are equal voices in creating a comprehensive strategic action plan. And your story behind the data may suggest new partners. And what is the willingness and the trust level for bringing new partners to the table? Facilitation can help to support all of these, because often people are going to look at the data in the same way and say, our data looks great, and look at other partners and think that, you know what, we're okay, even though their data doesn't look great, ours looks fine, so we're doing all right. The hour with results-based accountability at the population level is everyone. So you want the data and ownership of the data to be across the board with all of your partners. And this takes skillful facilitation to bring partners together in a way that is collaborative, and that all of the partners are looking together at what works, rather than looking at what program or what strategy are we bringing to the table. These are, as facilitated conversations, but the individuals who are leading these and guiding these conversations can oftentimes help to support the management of conflict that may arise about what works. Perhaps a community resident feels differently about what works, and their story is being told from their perspective. That voice needs to be as valued, and that can be challenging when you have various individuals in the room that are not accustomed to hearing those voices as equals. So facilitation of these conversations is very, very helpful. How do you get also to a place where you are having actions that are being implemented and not just the development of a plan? Oftentimes, a strategic plan can be written and it sits on a shelf, and there's no action by the partners towards that plan. And how well are you aligning the strategies of all of the partners together? In previous sessions, I spoke a little bit about high action and high alignment with personal leadership accountability with the theory of aligned contributions. I'm going to speak a little bit farther about that and talk about how you can get to this place of high action, high alignment. When you think about high action and high alignment, it's not an easy conversation to have. And some of you may have experienced that. I'm going to ask for a moment, do you have facilitators that are helping to support the guiding of your partners so that they're working together in facilitation of your conversations? And do you have volunteers that are facilitating your conversations? So look at your poll for a moment. Do you have a team of skilled facilitators and or project managers to help build trust in your community partnerships? We'll give you a little bit of time to talk about that. Do you have a team of facilitators and or project managers to help support the development of trust and the building of resilient relationships for your community partnerships? We'll give you a little bit more time for those of you who haven't weighed in yet. Okay, and we'll go ahead and close the poll. About half of you are stating that you have both facilitators and project management to help support as a backbone support organization. About 26%, about a few, have said that you have facilitation only, and 11% said you have a skilled team for project management, and 11% said that you do not have either. So that tells a little bit about the support that you have for your community partnerships. If I will share that this fifth condition, in the most successful community partnerships that I have been a part of or have observed, this condition is critically important because it helps to have a group of people that are committed to managing the infrastructure of a community partnership. If you look at the second area, the project management, I wanted to talk a little bit about the difference with a project manager, a project assistant, and on-site logistics lead. The project manager generally can take the lead in pulling the team together as a whole, bringing the partners together with making sure that those who are invited have the proper logistics and they know about the materials necessary. Oftentimes, the project assistant can help support documentation of the meetings. It's very critical to have a well-documented meeting so that you're building upon your previous work from meeting to meeting. And the last area, the on-site logistics lead, is helpful if your meeting moves from place to place to have someone on site that can help manage the logistics for that location. This may seem like a simple step, but it's often very helpful to have someone that is local to the organization or to the building that you're using so that they can deal with making sure the room and the setup is according to the design that you have preferred for each of your meetings. This helps to create a consistency around your meetings. So, and I would also ask you, when you think about your partners, who are some partners that may have be able to help support building the capacity for facilitation of your partnerships? So I'll pause there for a moment and go back to the high action and high alignment conversation. In order to bring each of the organizations together with high action and high alignment, I'm going to ask you to look at this slide that you see listed here. And on the upper right-hand column, you see where it says high action and high alignment. This is the leadership that, as a facilitator, the skills are most valued. Facilitators can help leaders to work together so that they're having conversations that are sometimes conflict laden, but that they're resilient relationships that expose the conflict, manage the conflict, and resolve the conflict. Sometimes this doesn't happen in just one meeting, but it can happen over several meetings. And a leader that has resilient relationships and can make collaborative decisions and be accountable for measurably improving community results is actually implementing shared strategies and working to strengthen relationships. This is what is referred to as high action and high alignment. The opposite end of that would be leaders that come to community partnership meetings that have low action and low alignment. These leaders might come, they observe what's going on, and they're not engaging in relationship building, they're not engaging in taking action. Sometimes they've been required to come by a supervisor, and so that's why they're in the meeting. And this type of leader is sitting on the fence and not connecting with others. As you look at these other quadrants, the high action, low alignment, and the low action, high alignment, you can think about who are the typical partners in your partnership. What types of leaders do you have in your partnership? A facilitator can help to build these types of relationships by bringing partners into action and inviting them into action in ways that sometimes someone that is chairing a meeting or the typical chairpersons of a meeting cannot do. And it's often helpful to have a facilitator that is neutral to the work rather than having a high stake in the strategy selection as well, because that person can bring about conversations that the group needs to have without having a point of view or a hidden agenda. As you look at these various types of leaders, I'd like to ask you, what types of leaders do you have in your community partnership? If you think about, this is a poll, the next poll that we'll be taking, as you think about the leaders that you're working with in your community partnership, what are the leaders like that you are working with? What level would you describe the leaders that are in your community partnerships? Are they high action, low alignment? High action, low alignment would mean someone's acting very independently, taking lots of actions, but they're acting on their own agenda. They're not aligning with other leaders. Low action, high alignment would be a leader that joins in with others, comes to meetings, but they're not really using the relationships to leverage the result. What types of leaders are you finding at your community partnership meetings? We'll give you a moment to weigh in on that. High action, high alignment is the area that we would hope that most leaders would move toward, where they're implementing shared strategies and working to strengthen relationships. So we'll go ahead and close that poll at this time. And according to your input, about 10% of the leaders are at that level that we would like to see high action, high alignment. 50% have lots of high action, but low alignment. 33%, 1/3 of the leaders have low action, high alignment, which means they're coming to the meetings, they're fostering relationships, but not really taking actions. And then low action, low alignment is 5%. That's good to see that that's a low percentage of the leaders in your community meetings. So how do you get to this high action, high alignment, where you're having transparent conversations with your partners? With results-based accountability, as leaders, we ask you to look at the result that you're seeking to achieve. And when you walk through this turn the curve thinking and you get to what works, take that rather than picking strategies that are aligned with your organization's own agenda, that you choose strategies that are really most impacting of the data, and that you use the RBA criteria of leverage, which means that it has a high likelihood of improving the data. So in a sense, you have to take your partner hat off and put on the hat of the result to say, what is going to improve this data for our community? Is it feasible and affordable? Is it specific enough to be implemented? Which partners would be engaged? And does it fit with community values? So each of these are the criteria that as partners, we would facilitate, as a facilitator, I facilitate these conversations, and many of you probably have facilitated similar conversations using other types of criteria, maybe in addition to these RBA criteria. But in some way, the partners have to come together and agree to strategies that would turn the curve or improve the data. It's helpful to have a chart or some way of rating these strategies. And this gives you an example of how in RBA you can use these criteria of specificity, leverage, values, and reach. Again, is it leverage enough to improve the data? The H stands for high, and so you'll see a high in each of these areas. You want to, as a community, not only have a criteria, but also have a way of rating each strategy to see how it fits your criteria. A trusting community partnership is able to authentically rate their own strategy selection to make sure that any strategy that goes into the comprehensive strategic plan is there because it will really improve the data, has a high likelihood of improving the data. Once the strategies are implemented, you also want to think about how will they be implemented as programs on the ground, and how can you begin to think about performance measures for those programs. Again, the questions that you want to consider are how much did we do, how well did we do it, and is anyone better off? So as a leader or a program manager, you also would have accountability for the clients once you are implementing a funded strategy, bringing that information back to the community partnership in transparent ways. This is another level of trust. This turn the curve thinking is repeated at the program level. So you can see that you can choose your performance measure as a program manager and walk through that same process for improving the data for the clients that you serve, and having a quality improvement action plan that your partners at the table can actually help support the quality improvement of your program as you discuss. Rather than just reporting out, you can share in trusting ways. This is where our data is right now for our clients. What do you think as partners that we can do to improve our own data? This creates a team of like-minded individuals and colleagues that have a focus, a laser-like focus on improving program level data, because the better the quality of program implementation, the more likely that you will have quality programs that positively impact the result at the population level. So how are you doing? The last poll that we'll take for today, I'd like to ask you a little bit about how are you doing at a program level in terms of sharing data transparently within your community partnerships? Do you have transparency of program level data so that individual partners are very open about what's happening with the clients that you serve? From your perspective, is there transparency of data sharing amongst program managers that are a part of your community partnerships? We'll take a few more moments for you to take that poll. Okay, we'll pause there and we'll close that poll. And 68% of you said yes, you have transparency around data sharing, and 32% said you do not have transparency around data sharing. So there's a significant number of you are sharing data at your community partnership meetings, and hopefully using that data to help build one another in areas and creating action plans that would work to better serve clients at the program level. I wanted to share with you a case study of program management and a backbone support organization with facilitation in Florida, building upon the idea of a movement and a culture of results being created in Florida. So the last case study that we'll do for today is around the Build Health Challenge with the Florida Institute for Health Innovation. This Build Health Challenge is in one of the communities in Florida that actually was part of the Children's Trust Read to Learn with the Campaign for Grade Level Reading. And it is a needy, vulnerable community located in Miami. And there's an ongoing community partnership that has been established by the Florida Institute for Health Innovation. And Dr. Roderick King is leading the efforts there through the Institute and has developed a team approach to supporting this Build Health Challenge. And they're using the principles of collaborative leadership and results-based, data-driven decision-making using results-based accountability. And they're looking at healthcare and public health and community leadership. And Liberty City has identified root causes for crime-driven health outcomes, and they're looking at continuing to build relationships with community and community residents, hospitals, health departments, and public safety officials, the police departments, to build healthy change in Liberty City. And the result that they have selected is a safe and healthy Liberty City. Very straightforward result, meeting in the community of Liberty City. And the meeting results, this is a sample of the meeting results over several meetings, about I think 8 meetings every 6 weeks. There is a meeting of partners that comes together. This is a sample of one of the meeting results from one of the meetings. And you can see that with facilitation, they have prioritized the factors behind health and safety in Liberty City. They're understanding strategies that have demonstrated successfully turning the curve. They're proposing strategies to help contribute to improving health and safety in Liberty City. They're looking at additional stakeholders needed for the work, and they're making individual commitments to action. These sessions are happening for a half a day. There's project management of the sessions that includes all of the elements that are part of the backbone support organization. So the Florida Institute for Health Innovation has provided the facilitation, the project management, a project assistant, and as well as on-site support with logistics. The leaders themselves are held responsible not for the project management, not for the facilitation, but these leaders are held responsible for commitments to action during the meeting and between meetings. This is an example of the accountability pathway that is part of the theory of aligned contributions by Jolie Bain Pillsbury. And this is being used in each of the sessions for leaders to state the actions that I took between last month's meeting and this month's meeting are really contributing to our collective work together. So the focus of the leaders is on their responsibility, and the implementation team has the responsibility for designing and setting up the meetings. I think it's important to note that by allowing leaders the time to focus on their own individual commitments to action releases them from the responsibility of setting up the logistics of the meetings and facilitating the meetings themselves. This has been a tremendous support to Liberty City as they develop their own community action plan to achieve a safe and healthy Liberty City. I'm hopeful that you'll also be able to share information about community partnerships in your own geographic locations. And as we can, hopefully, even though this is our last webinar in this series, you'll be able to email us and give us some examples of success stories of RBA implementation, collective impact implementation, or even how you decide that you will use the information that you have gained over the past few weeks. Our upcoming conference will be held in Baltimore, Maryland on June 1st to 3rd. And we hope that you'll be able to join us in the launching of a community of practice around results-based accountability and collective impact. In the meantime, I'd like to take some time for some questions. We have a few moments left. It's now on the hour, and I'd like to invite you to submit any questions that you have. If you have them at this time, you can certainly send them in. And as for those of you who are linked in from across and listening to the webinar later because you're in a different geographic location from this time zone, we invite you to send in examples of successes or challenges while using results-based accountability or implementing collective impact to drive efforts and to achieve results. So Marquez, I just wanted to check in with you to see if we have any questions for today.
No questions at this time, Dietrich.
Thank you. All right, so we'll move forward, and we'll share with you also that we have a pre-conference workshop that will be held on June the 1st, which is facilitation skills for results. I will be hosting and presenting that workshop on June the 1st. So I invite you to join us on that day, and you'll learn more about facilitating results-based accountability conversations and facilitating meetings to drive results, so that even the meetings that you have within your community partnerships are very aligned with the achievement of community results. We also have a collective impact track that will happen at Measurable Impact 2016. And there is, if you'd like to click onto the link that is located in this PowerPoint or cut and paste it into your browser, you'll be able to learn more about this track and our work towards launching a community of practice for results-based accountability and collective impact. Your feedback is very important to us. So if you could please take a moment to complete the survey that you will receive by email from Marquez Frazier. Be sure to check your spam folder if you can't find it. You'll be able to get copies of today's slides and a recording of the email, a recording that will link you to the webinar as soon as it becomes available. Thank you so much for your time. We've enjoyed connecting with you over the past several weeks as we have these conversations of results-based accountability and collective impact. And we look forward to staying connected with you as we continue to learn what it takes to achieve measurable collective impact using results-based accountability. Thank you so much and have a great day.